It is a great pleasure to be here today. Throughout history, women have made enormous contribution to science and medicine. From the Edinburgh Seven, the outstanding group of pioneers who fought for the rights of women to practice medicine, to today, women in medicine have been dynamic, galvanizing, influential, and inspirational. Our next keynote speaker is one of those women. It is my great privilege to introduce Dr. Barbara Sampson, the Chief Medical Examiner of the City of New York, a role that she had proudly held since 2014. Dr. Sampson is the first woman to lead the office of the Chief Medical Examiner since the agency was created in 1918. Stationed at the intersection of science, medicine, and criminal justice, each year, the agency conducts thousands of independent investigations of deaths throughout the 5 boroughs and analyzes evidence to bring impartial answers for families and communities affected by tragedy, and also to shape public health policy. Dr. Sampson describes the role of her office as using science and medicine to serve justice. Since her appointment, Dr. Sampson has focused on elevating the 100-year-old agency to meet the global public health challenges of the 21st century. Her initiatives include the expansion of the agency's world-class DNA crime, toxicology, and molecular genetics laboratories, reorganizing pathology operations to optimize service for families, and building the next generation of medical examiners through a nationally renowned training program. Most recently, during the agency's frontline response to the COVID pandemic, Dr. Sampson oversaw the largest mass fatality management operation ever executed in the United States. Dr. Sampson's professional biography is an extensive list of amazing accomplishments, ranging from a remarkable academic background to her renowned expertise in the field of forensic pathology. Dr. Sampson is board certified in anatomic, clinical, and forensic pathology, and has been recognized several times for her extensive research. She is a winner of several prestigious awards and has published extensively on cardiopathology and microbiology. She also serves on the editorial boards of 2 journals of pathology and few professional committees. Dr. Sampson is also an educator dedicated to the advancement of graduate medical education. As educators here at Berkeley College School of Health Studies, we are committed to preparing the next generations of caring, ethical, competent healthcare professionals through programs that provide defined pathways for rewarding and lifelong careers. One value that we aim to instill in our students is that they embody a profound sense of responsibility to their communities. And our students and alumni truly exhibited that value by responding to community needs throughout the COVID-19 pandemic. Many of them were in the trenches, working as healthcare workers or volunteers in New York City, New Jersey, and across the country. When I think about our students and alumni, I know how meaningful and empowering it is to have a leader such as Dr. Sampson to look up to. Medical science has transformed thanks to research, dedication, and compassion of medical professionals and scientists such as Dr. Sampson. As someone who studied medicine, I am mesmerized every day by scientific discoveries and inspired by phenomenal careers and accomplishments of medical doctors. Dr. Sampson's career, which has spanned decades in the fields of medicine, microbiology, and forensic pathology, is one that personally gives me great inspiration. And I know that it is motivational to many women who are pursuing careers in medicine, public health, science, and STEM disciplines. especially in a time when there is urgent need for gender diversity. Dr. Sampson and her team at the Office of the Chief Medical Examiner are leading the way in this endeavor. It is a great honor and a privilege to have a trailblazer like Dr. Sampson share with us words of inspiration. Dr. Sampson, thank you for being with us today. And without further ado, please join me in welcoming Dr. Barbara Sampson.
Good morning, and thank you, Dr. Skuka, for that introduction. It was very generous. And congratulations on 90 years of Berkeley College. So much has changed for women in that time. As an illustration, upon my appointment by Mayor de Blasio in 2014, the New York Times published a letter to the editor about a woman chief medical examiner being unthinkable 50 years prior. I'm going to read you the letter. It's by Martha Lear. To the editor, a woman as New York City chief medical examiner, exclamation point. Here's how unthinkable that would have been in 1966, when I did a profile for the Times Magazine of Dr. Milton Helpern, then the city's chief medical examiner. When I asked to see the autopsy room, he said, "That's no place for a woman. Must you go there?" I said yes. He replied, "Well, we'll bring a wheelchair just in case." "In case what?" I asked. "In case you faint," he said. Well, here we are now. I lead New York City's medical examiner's office. It's a government job, but certainly not a usual one. And all of you have notions about what we do from TV or crime novels. But let me tell you what we really do. As laid out by New York City Charter, we are charged with determining the cause and manner of death in cases that are sudden, violent, or unexpected. Of course, this includes homicides, but it also includes accidents and suicides. Accidents include drug overdoses. And in fact, a majority of the decedents we investigate have died of natural causes. And our job is to provide answers to all interested parties. As part of that, we perform autopsies. But we are also very reliant on a number of laboratories. For example, we have a toxicology lab that looks for drugs in the systems of our decedents. We have a molecular genetics laboratory that looks for genetic causes that may have caused someone's sudden death. Our DNA laboratory is the largest, most advanced public DNA laboratory in North America. It's larger than the FBI laboratory. When you hear on TV that the police have solved a crime using DNA, we're the ones that have done that DNA testing. That testing is important for identification. It may be the identification of someone from evidence at a crime scene, from a homicide, for example, or from the autopsy room that one of our medical examiners has taken in a homicide. Or it may be from a property crime or another kind of crime where DNA could be used to identify the perpetrator. In addition to that, the DNA laboratory is also responsible for identifying those that may be unidentified, from those like, for example, skeletonized remains. So it is a very large laboratory and a very busy laboratory. We are also responsible for mass fatality events. As someone who has been here at the agency for almost 24 years, when someone says mass fatality, that is synonymous to me with the events of 9/11, the largest homicide in United States history. Back then in 2001, we made a commitment to the families to identify as many people as possible from that terrible event. Most people don't realize that even today, of the nearly 3,000 people who died that day, only 60% have scientific identifications. It is often difficult for families to have closure if they do not have a scientific identification of their loved one. And that is why our commitment to identifying as many people as possible continues to today. As DNA science improves and becomes more sensitive, we continue our work on the specimens that have been retrieved from ground zero. And each year, we painstakingly make a few more identifications, and that is a commitment that will continue. So you can see that the impact that the medical examiner's office is widespread. Of course, we have a direct impact in the criminal justice system, testifying in homicides across the city. But we also make a great impact in medicine and science. And from knowing why people die in this city, we can inform public health policy in many areas to improve lives and to promote more equitable outcomes. In addition, the most important thing I would say that we do is we provide answers for families at the worst times of their lives. You can see that this is a very fulfilling career. Now, how did I get interested in this? Well, I was very fortunate that my mother is a physician. So I never doubted for a moment that I could be a physician too. And we often discussed what kind of physician I would be. And one time she mentioned the field of pathology. Pathology is a field of medicine that deals with the laboratory aspects of medicine, including performing autopsies. And then I found out about forensic pathology, which was just so interesting to me, even as a kid. This is where science and medicine can come together to serve the public and to serve the criminal justice system. So as I went through my education in medical school and then finally a residency in this field of pathology, I decided to join the New York City Medical Examiner's Office back in 1998, where I have worked since. It's the only job I've had as a grown-up. There are many women in this field, both here in New York City and nationally. That may be a surprise to some, but it is in fact the truth. And OCME, our office, the leadership has been heavily female for many years, even before I took over. Of course, there are still numerous challenges for women in STEM. I think back to my mom, who graduated in 1960 from medical school, a time when there was one woman in a medical school class. I also think back to her residency interviews, where an interviewer would ask her, why should we give this residency spot to you when you're going to take time off to go have children? Of course, the discrimination today is not as overt. And in fact, the women make up a slight majority of medical school classes nationwide. But we certainly need to improve the diversity there. And it is still a real challenge to find women in leadership roles in medicine, in science, and in academics. Why is it important to have a woman's perspective in science, medicine, and academia? Well, it does matter because I think it helps prioritize our attention as clinicians and as researchers. Heart disease, for example, has long been underrecognized in women, largely because women present in a way very different from men. Another area that has only recently been brought into attention is the maternal mortality in minority populations, which is vastly greater than in other populations. It is because I think more women being involved in medicine and science that attention is being raised to these important problems amongst others. I am proud to say that government in many ways is leading other sectors in gender equity. Locally, this New York City administration has a majority of women serving in senior positions. And that shows in priorities like universal pre-K, paid sick leave, and paid parental leave. So let me get back to OCME. Whatever your interest is, there is a place for you here at the Office of Chief Medical Examiner and an opportunity to make an impact. I have focused on our scientists and physicians, but we need people expert in everything, from budget and procurement to security and information technology. You can serve your community and advance your career, and dare I say, have a very interesting career with us. So please do reach out if you want to learn more. Our contact information will be in the chat. Lastly, I want to encourage each of you to use opportunities like today to seek out a mentor to help you negotiate your career path. So many times throughout my career, I have reached out to other women to ask them for guidance, and universally, they are eager to help. So please be brave and reach out. And this is important in every point in your career, not just at the beginning. I still routinely reach out to my mentors when I have big decisions to make. And it's a lifelong gift that we should each have and to support each other. So now it's time to hear from more women leaders in the next panel. Thank you so much for this invitation.
Thank you, Dr. Sampson. Thank you. The message is very clear, and it sounds like you may have some openings at the Office of the Medical Examiner. So thank you for making those opportunities available to our students. So we'll be sure to follow up with our career services team to give them access to those openings. We appreciate that. We appreciate your sharing your career journey with us and also inspiring us to connect with a mentor. Look at the chat room and students out there and attendees, and find somebody who's interesting to you who could potentially be a mentor. That's what this day is about. It's about inspiring the future. We really are so grateful for your being with us today, Dr. Sampson, and wish you much continued success.
Thank you.